Okay, welcome then to this session on evidence searching in psychology and behavioral sciences. So in particular, this 6-minute webinar will introduce you to the Psychology and Behavioral Sciences Collection EBSCOhost database, which is available nationally for those who work in the NHS in England. You may be outside of England and other organisations, you may have a subscription to this, or perhaps you're considering a trial. But that is the database that we're going to focus on in terms of the evidence searching. So just to formally introduce myself to this session, I'm Richard Crooks. I work for the EBSCO Customer Training Services team. I'm based in the northwest of England, and I currently manage a team of trainers who are based in the UK, the Middle East, and Africa. Okay, so thanks for joining in this webinar. So I hope that by the end of this session, you'll be able to create a search strategy using the PAO framework. Some of you may be familiar with PICO, Peacock, Spider, Spice, and others that are out there, but we are going to be using the PAO framework, which I'll get into details about in a moment. You'll also be able to apply wildcards and truncation to search strings as needed. You'll be able to create a search alert to keep current with the literature, also in response to what you found initially. And also, you'll be able to find further help and support information on EBSCO's databases. So we are using the PBSC database on the EBSCO's platform, as it were. So I hope that's what you're expecting from this session, whether you've been on one of these sessions before, but it could be a refresher for you, or you may be using PBSC for the first time shortly. Okay, so as always, if you have any comments, questions, or feedback during the session, please post it in the Teams chat. You can click the raised hand icon, and I'll respond to you as soon as possible by unmuting you. Okay, so just to give you the option if you wish to be unmuted as well. So just from the outset, PBSC, or Psychology and Behavioral Science Collection, provides over 329 active full-text non-open access journals and magazines. So one of the key things about this database as well, that users from subscribing institutions can link to full-text from citations within APA PsycInfo for the hundreds of full-text journals available in this database. So in other words, PBSC is available nationally in England. If you also subscribe to APA PsycInfo, then that data can also be transferred to APA PsycInfo. So in other words, the full-text records, the full-text articles that are indexed in Psychology and Behavioral Science Collection would also appear in APA PsycInfo. At least the link will appear, because APA PsycInfo, of course, is an abstract and index-only database. So you will find additional information on the content coverage on this website. So this is EBSCO.com. This is the public-facing website for EBSCO products and services, and you'll find the title list covering journals and subject on the main page here. So you see the link provided in this PowerPoint. Okay, so you'll find additional information about the content and coverage, but subjects such as anthropology, emotional and behavioral characteristics are covered, as are mental processes, observational experimental methods, and of course psychiatry and psychology. So this page, this website, will just give you additional information regarding the coverage. And just to highlight some key journals that are also indexed, so this database provides ongoing or active full text with no embargo for these journals. So Educational Child Psychology, International Journal of Mental Health, Journal of Individual Psychology, Mental Health, Religion and Culture, and Therapy Today. Also, Psychology Today, a leading psychology journal, is also included in terms of active full text as well, as we'll see. Okay, so just a snapshot, some key titles. There are others out there, of course, and you can explore those in your own time, and also refer you to the EBSCO.com website once more as well. So in terms of access, just as a recap for those who are based in England, if you're in other institutions in the NHS or for the HSC in Ireland or other organisations in the UK or Ireland, then you may have different access points. You may have a dedicated link, and it's a link to this database. You may have a search engine, and so on. But for those who work as library staff or healthcare professionals in the NHS in England, you can go through the NICE website, so nice.org.uk, as you see here on this screenshot. And if you scroll down, you'll come to this box, as it were, and there you'll find the link to find journals and databases. That in turn will take you to the following knowledge resources page. And on here on the bottom left, you can find the link to logging to Open Athens. And of course, if you don't have an Open Athens account, you can register for one, or if you need further support on Open Athens, there's a link there as well. That will then take you to the login page, enter your username and password, as it were, and from there it will take you to the subsequent page, which is the My Resources portal. And then to get to PBSC, you would need to go to the EBSCO databases link, as you see here. So this will take you then to the listing of the core databases that are available, or this page initially, the resource page. And from there, if you click EBSCO's research databases, it will take you to the choose databases page, which lists the core databases provided by EBSCO for the NHS in England. Again, you may have a less convoluted way to get to the database that you direct your users to. You may have a dedicated link on your library page, etc. And of course, the same applies if you work outside the NHS as well. But on here, you'll see we've got the link there to Psychology and Behavioural Sciences collection. This page also highlights the fact that you can cross-search databases simultaneously on the EBSCO's platform. So if you selected Medline or CINO or both and PBSC, then you would be searching across all three databases simultaneously. So that could be useful for scoping to see what's out there. But invariably, for more advanced complex searches, we would advise searching databases individually, especially because they use different indexing. Okay, so you would also notice there's a title list link there and a more information option, so that will give you additional information about the content and coverage of this database. Okay, just for background information there. Again, so you may well know this already. You may be even using this database for some time, and you have your particular access points for that resource. So again, any comments, questions, or feedback on this, please do feel free to post it in the Teams chat as needed. Also, if I'm going a little too quickly, please do let me know and I'll slow down. So in terms of this particular webinar, we are looking at a particular research question for the PO framework. Again, I'll come to that in a moment, but this is the question that we're going to explore. So what are the factors affecting the quality of life of family carers or people with dementia? So at the beginning here, you can see I've highlighted some key elements in relation to this particular framework. So we've got quality of life, we've got carers, and also dementia as the condition. So in a sense, we've got the three elements already identified here, as it were. So if we move on to the next slide, you'll see this is where we begin to create an appropriate search strategy for PBSC using the PAO framework, otherwise known as the population exposure or outcome. So this allows us to neatly divide the various elements of the query into these columns so that we can begin to interrogate the database to find what's out there currently. So the population we're looking at today are really the participants. So they're not the patients themselves, these are carers. Then they're exposed to obviously relatives, family with dementia, and obviously our concern, our interest is the quality of life of those carers. So that is the third element, the outcome. The second row that we see there is the synonyms, the terms that we should be looking for when we're running a search on this database. So what are the terms used by authors, researchers, editors, etc., to identify this particular population group or these participants? So care, of course, or carers, plural, caregiver, care worker, possibly support worker as well. Then there's exposure. Also, we're looking at dementia. We also can consider Alzheimer's disease. And the third column there, quality of life, or QOL, as an acronym, well-being, either as a single word or two words, and also lifestyle or lifestyles, etc. So this is where we're considering our free tick search terms that we could be using when we want to identify what's out there, what's relevant to our particular research question. The third row that you see there are the, in uppercase and italicized, are the actual subject headings that we could also be exploring. So we will run a combination search of title of free text and subject searching for this particular query. So we've got caregiver education, caregivers, caregiver attitudes, for example, under the population column, or participants again, exposure, dementia patients, Alzheimer's patients, etc. And quality of life, again, could be a subject heading, quality of work life, quality of life measurement, lifestyles, and so on. So this is where we're really brainstorming, preparing to run our search by considering the various search terms that we should input in order to retrieve relevant content. So again, anyone has any comments or feedback about this, please do feel free to share in the Teams chat. And if you need to be unmuted, I can do that if you select the raised hand icon. So that's the PAO framework there with the three columns. Now, I also want to mention the truncation wildcards used for this database on the EBSCOhost platform, very similar to what you'd see in CINO Medline on EBSCOhost. So for truncation, we use the asterisk either at the end of a term or between terms. So if you're looking for bulimia and bulimic, if you just put the asterisk after the I, you'll find both variations. If you're looking for cognitive therapy as well as cognitive behavioral therapy, then you can insert the asterisk between cognitive and therapy and find both variations. For phrase searching, for exact phrase searching, you can use quotation marks or speech marks. So if you're looking for anorexia nervosa, you put them in quotation marks, you'll find at least one occurrence for each record retrieved where that is an exact phrase. For wildcards, we have the question mark to replace a single or unknown character. So if you're looking for psychosis and psychoses, then just replace the appropriate E and the I or the I there with the question mark, and you'll find both variations when you run the search with the question mark. Now, for alternative spelling, you can also use the hash wildcard for pediatrics and behaviour. If you put the hash wildcard before the E, after the P in pediatrics, that'll find both US and UK spelling. And also for behaviour, if you place it after the O before the R, you would find behaviour in UK US spelling as well. Okay, so this will also include the PowerPoint for you to refer to post-session. Now, we also have the use of proximity searching as well. So the near and within operators are used within the EBSCOhost platform. So near will find words if they are within a specified word range or less of one another, regardless of the order in which they appear. So childhood N5 obesity means it will look at the word childhood within 5 words or less of obesity, as well as obesity within 5 words or less of childhood. Okay, so it's quite broad. Within finds words if they're within a specified word range or less of one another, and this time in the order in which you entered them. So using the same search, childhood W8 obesity would find childhood within 8 words or less of obesity, but not obesity within 8 words or less of childhood. Okay, so it's more restrictive. So multiple terms can also be used on either side of the operator. So if you look at anorexia or bulimia in children, you could, in parentheses, put anorexia or truncate it for anorexia or anorexic, or likewise with bulimia or bulimic, using asterisk again, N3, so 3 was less of child, and that's also truncated, so that would be child, childhood, children, etc. Okay, so you can use it on either side, use multiple terms can be used on either side of the operator as well. Now, so you may be familiar with this based on previous attendance at CINO Medline sessions, but just to recap that in the context of this particular database. Okay, so that is what I want to cover just as the background initially for this particular session. So what I will do now, in a moment, I will go to the actual website, the NICE website, to begin our search, as it were. So let's go to my desktop now, and I'll share my screen. So let me just remind you that we're going to the live demonstration now, and I'll share my screen here. Okay, so you should now see the NICE website. So National Institute for Health and Care Excellence. And for those that, again, in England, you would scroll down to the bottom half of the page and click on the Find Journals and Databases here, and then come to the Knowledge Resources page, and you'll see we've got the Athens login here. So log into Open Athens on the bottom left there, and then it will take you through. So I have logged in previously, so I'm taking now, I bypass that second page because that would be where you enter your Open Athens username and password. I've come to this page, and I'll click this link, EBSCO Databases, and that in turn will take me to the subsequent page, which we saw on the PowerPoint, the Set Resource page. And this time I'm going for EBSCO's Research Databases. And from here, we are going to choose Psychology Behavioral Science Collection. Notice, again, you've got the title list here. So, for example, if you click on that link, it will give you a listing of the various journals indexed here. It also highlights the full text coverage of these titles as well. And if you go back a step, we also have the more information link, which gives you additional information on this database. So if we open it up, and in particular, it gives us the searchable fields. So in other words, the default fields for unqualified searches, what they are if you don't qualify these searches with field codes like title or abstract. And it also gives you the searchable tags or field codes that you can use for run command line queries. So for example, you can see here we've got GE, geographic terms. So if we're looking at a specific territory, etc., within the world, GE, Great Britain, for example. So have those listed there as well. And we also have definition of fields here shown as well. So if you're unclear again about the different fields, so you can see the contrast between geographic terms, which relates to the specific articles, geographic subject headings, describing the article's record's content, in contrast to the country publication, the country in which an article was originally published. Okay, just highlight 2 of those elements there. So that is also the help menu there, by the way. So we will go now into Psychology Behavioral Science Collection and begin to run our search here. So of course we are looking at the first one of PAO, which is the participants, and we're looking at carers in particular. So we can do a number of things here. We can of course truncate. We can put, for example, care or carers, and then or care workers. We can put that in care worker. We could actually put that in quotation marks. Okay, let's see what else. We could put support worker, okay, or we could do this. We could just put or, let's see, care or support, okay, or worker, okay. So Okay, so we can just something like this, care work. Actually, it could be care work or care worker. So let's just truncate it in this fashion. Okay, so we could do these things. Let's see, or and there maybe. Actually, I have to review the search from time to time, so I'm doing something different here today. Okay, so we're this could be the first iteration of our search. So we could be, we'll review it as we go through each time we run the search. Now, what we can also do here is we could expand this to search within the full text of articles too. So if you look on the bottom right there, we've got these expanders here. So I can search within the full text of the articles. I can select this option too, and we're not going to be searching the initial fields, which are the this is the unqualified search, like for example, title, abstract, etc., author, field, and so on. We'll be searching across a range of different fields, but we are not going to qualify it with the title abstract search today. We're just going to do it as a more general search and search within the full text as well. So we're going to click the search here. Okay, and that is the initial carer aspect of the participant aspects of this PAO, but we can also explore the subject headings as well. So we're going to combine the two together. So if you go to subjects here on the top left, we can then begin to explore some of the terms. For example, if we put care worker here or carer, right, and then we'll go for relevancy ranked here and browse, then you'll see we've got a caregiver education here, and we've got caregivers as well. And those are also, if we follow this across, you'll see you've got this explode option. So the explode option indicates that there are narrow headings that would also be included when we select caregivers. And if you want to know what they are, there are two ways to do that. First of all, you can click add, or you can simply click on caregivers here, and you'll see along this list, we have some of these related terms here. Okay, in fact, it says caregiver education is included there as well. Okay, so these narrow terms, by the way, these are the narrow terms. So these narrow terms are included when you explode this term. Okay, so it includes caregiver attitudes, libraries and caregivers, long distance caregivers, etc., and so on, women caregivers as well. So if we now select these terms, we click add, you'll see them appearing in the box above. So we've populated this box with these subject terms. So you can see each of these terms, and invariably they're mentioned, they're indicated in uppercase, in some cases in parts of the terms, but you will see DE as the prefix for each of these terms. So that indicates these are subject headings. DE is descriptor, and it's the field code used to identify subject terms from within this database. Likewise with PsycInfo, if you use Medline or CINAHL, you'll notice that MH is the actual field code for medical subheadings or CINAHL subheadings as well. So there are differences between the indexes, which again is one of the reasons why you would not cross-search necessarily for more in-depth searching, because they are using different indexes. So I'm just going to click search, and I'll refer to the question from Karine. So let me just click search here. We run that search. So Karine's asked, does the database allow adding a number after the asterisk to retrieve specific word head endings? So okay, let me just rephrase. So does the database allow adding a number after the asterisk to retrieve specific word endings? No, not with the EBSCOhost interface. You cannot add a number after the asterisk. There are other ways in which you can limit the number of characters after the word, and that is combining the hash wildcard with the question mark. And I can refer you to the help menu for that, but you will not be adding, as far as I can recall, a number after the asterisk. Okay. Okay. So we've got the two searches. One is a free text keyword search, the other one, the set one, and the other S2 is the subject search. Now, by default, as you probably gathered when you've used this database previously or other databases like Medline and CINAHL EBSCOhost, the default setting for the search history is to show it in reverse chronological order. So if you'd like to see it in sequence, as I often do, and for reporting purposes, then click search ID in hash above the set number on the left there within the search history, and this will resort for you. Okay, and then what we can do with this, we can then combine the two sets and combine with OR, because they are related to the same participants, carers, and we group them together. Okay. Okay. So we have our results there now, and we're going to now go into the stage of actually, looking at the exposure. So this relates to dementia. So again, we'll follow a similar approach here. We're at dementia here, okay, or Alzheimer's. By the way, the search is not case sensitive, and it also ignores punctuation as well. So dementia or Alzheimer's could be just what we're going to refer to now in this particular query. I think we can go with that for now. And this time again, I'll make sure we've got the, I think that's on actually. If I go to show more here, yeah, make sure this is on as well. Okay, so I'm not sure what happened here. Sorry, let's see. I think it's just defaulted to the previous set. Sorry about that, but I'm going to click new search here. And then, so I'll click new search. Make sure this is also on, and I'll add dementia or Alzheimer's and run the search here. So we're doing a keyword search again, an unqualified search combined using also the expanded to search within the full text itself. So we've run that search. That's the keyword search. This is the second element of PICO, and this time, sorry, PAO. And this time we're going to go back to the subject headings, click the link on the left toolbar, and we're going to search for dementia or Alzheimer's, and just bring those up. Okay, so we've got Alzheimer's disease here, dementia care units, rehabilitation, etiology, Alzheimer's patients, a lot of things there. Do we want the others? We can include all these if we need to. Okay, so a lot of subject headings that relate to what we're looking for. Some of these, of course, will be duplicated because they're exploded. So, for example, we've got care of Alzheimer's patients and Alzheimer's disease. We may not even need these, to be honest, because they should be covered in the other, excuse me, the other areas. So what we can do here, so again, just click this one again. We've got those three elements so far. And again, if we click add here, we'll see the terms that are included at the moment. So Alzheimer's disease, genetics, care units, etc. So that may be sufficient, but we've got some others here that are not included, so we can add these as well. Like etiology, Alzheimer's patients should be, it's not there actually, interestingly enough. We've got care as well. Patient fairness, this could be quite important for this particular search. So the others, again, some of these we could include as well. Social aspects may be particularly relevant here. Again, care of Alzheimer's patients is one we're really looking for, I suppose, but we've got others included at this stage. Rehabilitation, I think we can also include that. So again, it's your call as to what would be most relevant, what is most appropriate. You may, again, revise this search and decide that you do need those elements included as well. But we'll go for those for now, then I'll add those. And I'll change this to or this time because it is or, not and. Okay, so we'll look at or these elements as well. Okay, so we're going to run this search now. And then we've got our results below. And so we can also, by the way, when you spot any errors, a question from Caroline, why did you click on new search as you had begun a search? Basically because I wanted to factor in the also search within full text expander. So when I tried to do it previously, it wasn't sticking. So I had to go back and make sure that that was selected before I ran the search. So you'll see, for example, S1, I've got also search from the full text because I started with the home page, and I've got it now applied for S4, which is the exposure element of the keyword search, but that wasn't sticking when I tried it earlier. Okay. So that makes sense. So we've got these elements here. I'm going to combine the two, S4, S5, okay, and combine with OR. Okay, so we've got results there. And that is exposure. So of course we are now looking at the quality of life as the outcome. So that's the next search we'll do. So again, maybe for the purposes of this, I'll go to new search because the search history is there in the background, and I'll run my search. So quality of life. I could use this quotation marks for this for an exact phrase search. I can combine it with the abbreviation, QL. I can also look at lifestyles, or sorry, well-being. Again, well-being could be one word or could be two words, and I'll put that in quotation marks as well. Okay. Likewise with lifestyle or lifestyles, you can put lifestyle or lifestyles. Okay. I'll just put that there. No, okay, trunking that as well. Okay, so I've got those terms listed there. Okay. And then this again will be the keyword searching that we do. Again, I'll put the or enable the also search in the full text articles feature, the expander, and then click search here. So again, it's our keyword search, and this is the O element or pair or the outcome. So we see results there. Okay. Now, the final thing I'll do will be to actually run the subject search for quality of life. And there is an option, by the way, if you go to search select field, there is a SU here. This is a generic word search of the subject index of this database. So SU is in contrast to DE. And if you want more information on the differences, if you go to the help menu on the top right, if you open up this and scroll down, all the way down, you'll see the database out for this database, PBSC. So click on that URL just by my taskbar there on the bottom left. Go to searchable fields again, and this time you'll see DE, which I mentioned earlier when you're selecting from the index. This is phrase indexed and performs an exact search for subheadings and author supply keywords describing an article. So if you look at World Health, you can put DE World Health, and it will perform an exact search for that subheading. If you contrast that with SU, if we scroll down again, this searches the subheading that each article is given. Okay, so it's more generic. If you use it in the context of headline or CINAHL, it's word indexed. So D is the definitive field code or tag for searching by subject, the exact subject that is used by indexers to identify content within this database. Okay, so we've got that element, and now the final thing, of course, the final set is to look at the equivalent subheadings for quality of life within PBSC. So again, go to subjects here, and then we'll browse for quality of life, or well-being, and then browse. Now this time it doesn't bring up well-being, so if we just treat it as two separate words, I think you will see it up here. Okay. Or maybe not at this time. So we've got quality of life there. So that's fine. If we click add here, you'll see that includes cost of living as well, health status indicators, and so on. Okay. We've got student well-being. May or may not be related. If we did well-being on its own, we have got well-being here. So we can use well-being as an option. In fact, as you see, it's actually included here. Okay, so it's already been included with these other elements. So we don't need to select that again, although there is psychological well-being here. We can also include that as well. Subjective well-being, perhaps employee well-being. Human comfort, perhaps happiness, could be also related to this particular query. So we can choose those and add here as well. Okay. Again, I'm going to change it now to or, because these are kind of synonyms in a way. If you could say that they relate to the same kind of matter outcome that we're looking at. Okay. So we can run the search here for these index terms, and I'll also mention as we do this, when you are using the search history, you can still adjust it if you need to. If you spot any errors, you can go into any one of these search strings, S2 for example, go to edit, and you can make changes to that with the search terms, either removing them or adding others there, or just correcting. And likewise with the subject searching or the keyword searches, if you spot any typos, etc., any errors, or you simply want to add other additional terms, you can do so before you complete the search. So you can make changes to this. So if anyone's spotting any errors, please do let me know. Okay, so we can now combine S7, S8, which is the third set of PAO, the outcome related to quality of life, well-being, and so on. We can combine them with the Boolean OR here. So we're grouping each of these elements together, whether it's a title, a keyword search or a subject search for each of the three elements. The participants, which relate to carers, the exposure relates to dementia, and then the outcome, which relates to quality of life. So now we've done this, and I've done various iterations of this before, so I might end up with different results than I did previously. But I'm going to choose S3, which is the carers aspect, the P element of PAO, then the E element of PAO, which is the dementia, Alzheimer's, and then the outcome O, which is S9. So we've got three sets to group together, and we'll click search with and here. So if we scroll down, we'll see what we've done now. So we've got our results below. It's got 1,700 records here from this search. Okay. And at the moment, by default, and this is the common default setting for the NHS in England, is the most recent records that are displaying. Okay. So, I mean, you can see it does mention caregivers of people with dementia, which obviously is what we're looking for. So, and you can see item 3 relates to quality of life as well. So, but we can resort this. If we go to newest here, we can go for the most relevant and scroll down. Okay, so you can see we've got now. Okay. And you can see various elements of our search featuring highlighted in bold, in the title field, Alzheimer's, mentioned dementias, well-being, Alzheimer's disease are indicated in the subject field for this record. Lifestyles mentioned in the record below. So you can see the advantage of using multiple keyword search terms and also certain things to ensure and guarantee that you're finding relevant records here. Okay. So if you are satisfied with what you've got here and you find ones that are particularly relevant, then obviously you can go through this listing and you can explore them. So you can go, for example, this first one, you can look at the whole record or go to the magnifying glass and hover over that to view the abstract. Or you can go directly into the article itself, into the reference, and view the abstract here to see whether or not it's suitable for what you're looking for. Okay. Just take another one here. Let's see. For example, this one here as well. And you can also, of course, check other articles by the same authors by clicking through to the links there or viewing articles indexed with the same terms. Obviously, this is coming from the International Journal of Geriatric Psychiatry, published in January of this year. This also happens to have a PDF article, so you can also explore the PDF as well. Maybe you'll check for further references there as well. You might have cited references listed there, which could be particularly useful for other articles. So this is coming through LibKey, which is the link resolver provided by Third Iron as part of the national deal, as it were. So, and you can see the Wiley research article there. So again, you can explore this article in your own time. You can check the content there, or if you scroll to the bottom, you can view the list of citations and click through to other articles which may be of relevance here that you may not have picked up in the original search. Okay. So for those who are working in the NHS England, you will see links to PDF. So that could be Get PDF will be the LibKey Nomad link resolver provided by Third Iron. You may see Access Online, which will be the I think that's Access Item or Access Item Line is the EBSCOhost final link resolver, or you may have PDF or HTML links as well to other EBSCO content. Okay. So again, I'm happy to pause there if there's any questions at this time before we go any further with what we're looking at today. So any comments or questions so far about searching, retrieving records, or even displaying them if necessary? I won't go into all the features there because we do cover that in other sessions. but we will be looking at search alerts shortly. Again, feel free to post those in the Teams chat. So Karina asked, did you select specific fields for running the search? No, I didn't. In terms of the keyword search, I kept it quite general, an unqualified keyword search. If you were searching in the same way for this topic, but using title abstract fields, so for example, you can see S1, which is zoom in a little here, doesn't have any field codes to qualify it, whereas S2 does have DE. So for the subject headings, that is also included because I was exploring the subject index of this database. So DE is the field code that I'm running a search via. In other words, so I'm searching the subject index, which means I'm exploring DE, the field code. Okay. For the keyword search, I did not qualify that. If you were to do that, then if I just take the first string here, what you could do, if I copy that across above, then you would choose title here, below you take abstract, for example, also, and then paste that in the row below. So you could run this search, which is much more focused. Okay, so there's some debate as to whether you would do a title abstract search, combine it with a subject search, or whether you do a general unqualified search and combine it with the subject search. Okay, obviously, with a more general unqualified search, you are going to retrieve more hits, more references, but they may not always be so relevant. Okay, so title abstract does make it more focused. And if you're a supporting assistant review, it's kind of the approach that Cochrane would take and some other organizations, but not all. I know universities who do not encourage that. They feel that to do the general unqualified keyword search is good, combined with the subject headings as well. So interesting your feedback on that. If you've come across this, if you've experienced this yourself, what you would tend to use. In other sessions, I do cover title abstract searching on the EBSCO interface combined with the subject searching. In this instance, I'm just going through the unqualified search. Okay, so I hope that answers the question. So let me just zoom out a little bit here. So what I'm going to do now at this stage, obviously we're going to explain, exploring the full text. I will just also mention here, you can see we've got various other links here. HTML full text, it simply gives you the online article that you can view. And it also gives you the option to translate articles from, in this case, it'll be English to another language, or if it's another non-English article, you can translate it back to English. Okay, so that's probably by Microsoft. So Microsoft Translation. There's also the text-to-speech software to assist those who are visually impaired to improve accessibility to content, and that gives you the settings there to change the highlighting colors, etc., that are used. Also, there is the reading voice you can select from, whether it's Australian, English, or American. And then you've got the option to enlarge text, the text mode as well for, again, improved accessibility to content here. And there's also the page mask as well. Okay, so you would have seen as well. And then the option to download the file, the MP3 file, and listen to it being read offline as well. And okay, another question here, just to clarify, so from Corrine, you said at some point searched in the full text. Does it mean articles not available for text in the database are not searched? No. So by default, when you're doing an unqualified search, you're searching across all those citation fields I mentioned earlier. And if you apply the expander, you are still going to search through the citation fields. But in addition to that, any item that's indexed full text, so I mentioned there's over 300 journals indexed full text in PBSC, then you would search the full text content of each of those publications, those articles, etc. But doesn't ignore the other articles that are non-full text. It just means that you are searching across all index content within PBSC, but you expand it to search directly within a full text article where those are available in HTML or PDF format. Okay. So I hope that clarifies that question. And of course, on the right-hand side, we've got tools, Google Drive, OneDrive to process this. You can add items to the folder if you need to. You can print, email, save, cite. So there's a cite tool here for those who use the APA reference style. You can see there's a reference there to this article in the APA format here, or if preferred, you've got Harvard also included here. So they're alphabetically listed, but we always advise users to consult library resources for the exact formatting punctuation. You can export article directly from this page as well. Likewise, in the result list, there's an export option as well. So you can do a direct export of this article in RIS format or IRIS format if you need to, and other we support multiple bibliographic software such as RefWorks, EndNote online as well. And the permalink is the link that you'll be using to direct users or yourselves back to this article if you were to share this reference. Okay, so if you wanted to send the link, can't paste it in the Teams chat or email, then whoever receives it would need to authenticate in a little fashion. Okay, so just key points there. Again, this one has a PDF article as well, format, equivalent PDF there. So you can read the article in its original format, layout, as it were, in PDF, and download or print and use the tools accordingly to direct users to. So the permalink this time would direct you to this PDF page, not the HTML article. So again, so this I cover in other sessions, so I don't spend too much time on that to make sure that we keep to time. But there's also the view complete issue that's coming from the browsing, which is the AZ service provider by Third Iron. There's also the request link. This again is relevant to those who are in England. In the NHS, you've got this option to request an article via the interlibrary loan form as well. So if a user cannot access it directly full text, they can still request it from yourselves. Okay, and that will be defaulted to the local arrangement there as well. So again, numerous links there to get the full text, or otherwise request the article if you need to from others. Now, you have got the search history here, and you can print the search history. Okay, so if you want to share that with anyone, you can do that. And if you right click, you can print, and you can also save it as a PDF if you need to. Okay, and save it in the right format preferred. So you have that option. What I wanted to touch on is setting up a search alert, as I said at the beginning, to create an alert to be kept current with the literature in relation to this subject. So if you click Save Search Alerts, unfortunately, it's now giving me an error message, which I've not seen before. So what I do here, I'm just going to close this one down, and I'll try that again. So if we go to Search History, oh, it's actually removed my search, unfortunately. Okay, so what I might do here, I believe I may have a save search for this. So if I go to sign in here, so for those who are based in England, when you authenticate with Open Athens and then you click on to sign in here, it should automatically sign you into a personal folder. Okay, so it should now come up with that. Or in a moment. Yes, so now I'm signed into my folder. If I go to my folder, I'm hoping I've saved this previously. I'm going to go to my, in fact, my save search is not there. So what am I doing? Going to this one here. See if I can find, nope, nothing there. So what I might do, I'm going to decide I don't normally do, that's switch accounts here. So I'm going to go to my switch accounts option on the top right. So I have different folder accounts. And I'm going to sign in here. And hopefully bring this search up and then reshow it for you. So that's just a temporary glitch, I think, that occurred that I wasn't expecting. So if I go to my saved searches, I'm hoping I've got a saved search for this particular PO1. I'm going to do it in name order. And facts, let me see. Maybe I didn't save this one. Oh yeah, sorry, it's under this Keratin. So this is the one that I did earlier. So I'm going to click retrieve. You may see some different results here, by the way. So I'm going to click search ID in-house to resort this. So you can see I did do a title article search in the previous session on this one. I did it differently today. Refresh this, and just to bring these up. Okay, so this is a search I saved. I've got it down to 473 references here. Again, I was using title article searching combined with the subject search. So I've got my results here after that glitch there, and I click Save Search Alerts. Now that I'm assigned to my folder, it does give me the option to set up the alert. Before I do that, I can actually edit the search. If I want to change anything here, I can go to any one of these areas. So for example, if I want to look at English language journals only, I can go to edit here. Let's see, does that have English? Maybe it doesn't. Let's see, or peer reviewed content, for example. If we go peer reviewed only and click save, then I can look now at peer-reviewed content. So the vast majority of content here in this database is peer-reviewed. So it's gone through a peer review process. Okay, just referring back now to another question from Caroline. When you export references, does it include the permalink? Yes, it would. It should include the permalink as well. Okay, a link to the item. So we've got these results here. I'm going to save that now, but then I want to change the alert name or add the alert name. So this time I'm going to put it as PO carers and dementia. Okay, I'll just put it on that one for now. Get that right. And then I can set up the alert for this. So choose the alert radio button, then determine the frequency. How often do you want to alert yourself or a user if you're doing it for them with the latest information? So it could be maybe once a week. Articles published from the last month, 2 months, 6 months, 1 year, or no limit. I would go for perhaps 6 months and then run the alert for up to 1 year or minimum 1 month. So I'm going to run it for 2 months actually. Okay, and then I can choose the format of results. So do I want a brief citation, which is just basically basic citation? Do you want to include the abstract, which I do? Or you could choose it if it's more appropriate for bibliographic management software like EndNote, Zotero, and so on. Then I can add the email address it should go to. It can be more than one person, so you can use a semicolon to do that. You can hide addresses as well from recipients. Add the search subject, so I can say PBSC search for now. PO search. Okay, and then the one thing to note here is the email alert from address. So epalerts@ebsco.com is the default email. Okay, sorry about that. Just a call coming through. Email from address. So basically, there are two reasons why you might change it. One is if the emails are going to the junk mail folder of user or it's blocked by spam filter. The next element is that if you add your own library address here, so it's your personal work address or your generic library address, then the kudos for the results coming from this search, the alert is towards your library service, in other words. So the user, as far as they're concerned, this is an alert that's generated by the library service in their area of interest, as it were. Or if they've requested this search, you updated them repeatedly with the latest content. Okay, so if you put in, for example, I used my generic example, library at, and it's just .net, then that's what they will see in the inbox. It may also mean that it won't get blocked, and it also means that they may not delete it in error. Okay, and then you can choose plain text by default or HTML. This option that you have as well, and then you can include the query and frequency, also an email, and click save here. Once you do that, you get confirmation the alert has been created. You can see the alert name, the database it's running on. It's going to run for 2 months on a weekly basis, as it were. You can see the search also includes the peer-reviewed filter, and then there's the RSS URL if you wish to use that, and then click continue. So if you want to edit that or retrieve that, review that, then go to the folder on the top right. And then if we go to date, you can see that save search is there. We've also got search alerts here. And now you can see this one, PEO carers and dementia. And again, you can see the criteria here. It's going to be sent in HTML format to my inbox at crooks@ebsco.com. I can also retrieve the alert to review it and rerun it in the search box, in the search history, or I can go and edit this and make changes. So, for example, when an article was published in the last 2 months, not 6 months, etc. Maybe I want to run it for 6 months, and I can click save here. So obviously you can educate your user how to do this to set an alert so that they can keep themselves up to date with the latest literature on a given topic, research question. In addition to that, you can do this for other users as well proactively in support of a evidence search that you've done for them in psychology and behavioral sciences. And of course, if they no longer require this information, then you will need to go through the process of edit or removing that. So simply you need to go through to this and select it and delete. Okay. And they'll no longer receive those alerts. So just wanted to highlight that particular functionality. Okay. And just to go back to the exporting, so I know Caroline raised a question there. If you wanted to export results from this database, you can simply go to the share option, and you'll see the export results option is there. Export email link to download exported results, and it will include all 473 in this instance. Okay, and you can add the address of the recipients it should go to. You can choose the format, so IRIS format for Zotero, EndNote, etc., and you can send accordingly. So that will send a link, a dedicated link, which will be available that you can then use to retrieve exported items. Okay, so that's going to my inbox and be valid for up to 7 days. Okay, so that should include the links to content where appropriate for these articles. Okay, so that is another option you have to export records directly from the EBSCO interface here. Okay. So again, I won't cover some of the functionality for saving. We do cover that in other sessions as well. I will just mention at this stage publications as well, because obviously users may want to look at a particular publication, and there are publication alerts that you can also set up as well. So if I go to publications on the top left toolbar, then if you search for a journal like the Psychology Today journal, so I just select this and browse for it within the index there, and you can see it's available full text from 1992 to the present in both PDF and HTML format. So if we click the Psychology Today link, and then you can browse the issues there that are available, the current issue, etc. But in this instance, we're going to look at the alert for this journal. Go to share, click email alert, and then you can go through a similar process that we just did. You can add your name here or name of the receiver, the recipient. You can hide just from the recipients. Again, you can change the email from address to something more appropriate for your library service. You can change the result format again if you want to include the detailed record, in other words, the abstract, and then you could save the alert here. So you may now wonder, where is that stored? If you go to the folder on the top right, you'll see here we've got the save searches again, and then on the bottom left there you can see the reference to journal alerts. And you can see now I've got 2 journal alerts, one on Harvard Business Review and this one on Psychology Today. So basically it means that you could be proactive. You could email regularly your users with the latest content of a given journal, if appropriate, of course, seek their consent as well, or maybe for yourselves as well. Okay, and of course you can educate your users to do the same so that they can track the content, the latest content for a given journal indexed on this database. And again, if you want to edit that, you can. With journal alerts, by default, they will run for up to 6 months. You can extend it to 1 year or minimize it to 2 months. And just in case you're wondering what happens if it expires, you have the option to extend it before it expires. It will notify you for the search alert and also for the publication alert. You'll be given the option to extend it if you need to. Okay, so it won't just suddenly disappear. You'll have the option. Now, if you do set this up for individuals, because the confirmation changes here, then you are responsible for editing and also deleting if no longer needed. So for example, this one, if a manager who received this link, this article, Harvard Business Review, the latest content, and they left the organization, then they no longer require that. So you could delete this, or if they simply inform you one day, I don't need these links anymore, I don't need the latest content for this journal, then you can simply go in and delete it from here. Okay, but as with the search alert, the journal alerts, you also need to be signed into my EBSCO folder, which for those in England is single sign-on. So once you're authenticated via Athens into the database, when you click sign in, as we saw earlier, it will automatically create the folder for you and you'll be logged in to do that. Okay, so again, we've had a look at the help menu earlier, so just go back to there on the top right toolbar. This is the generic help for the EBSCO's platform. So we're using Medline, Synod, or PBSC in this instance. These would apply here. Again, there's reference to the expanders here and what they do. Okay, and notice here in relation to the previous question, also search from the full text of the articles. Select this option to search for your keywords within the full text articles as well as abstract and citation information. Okay, so again, it's searching across. If the article doesn't have full text, it cannot search within the full text, but it will still search within the citation fields. Okay, more references to proximity searching. We didn't actually use that directly today in the session. I just wanted to inform you of what's out there, what you can do. But again, some examples, there's some generic examples, like with wildcards and truncation symbols, also included here as well. Again, some more detailed information on those as well. And then the reference styles given there as well. And again, there's a direct link to the database help menu. Okay. Now, I know we're almost out of time, so what I'm going to do now is go back to my PowerPoint, just show that again, and we'll begin to close. So again, if there's any more questions at this time, please feel free to post them in the Teams chat. Okay, but just to reassure you, I've included some key links to documentation, including tutorials for some of the key elements of searching, saving, and alerting. Okay, and also we do have the Healthcare Training Resources portal, which we like to keep up to date periodically with new sessions. So on here, you'll find recent recordings of training videos, training sessions with up-to-date listing of my trainings, and also support information as well. And there's additional content, links to other training sessions hosted by the NHS in England, EBSCO Academy, which is our learning management system, which also provides e-learning paths for library staff, EBSCO Connect, which is our generic support portal and promotional materials as well. We do offer additional training on Zoom. These are for other typically non-healthcare related products, not always. Some are health related like Cinel, but things like EBSCO eBooks, Flipstar, digital magazine service, Full-Text Finder, Open Athens are included there, and I have colleagues who host those sessions. And again, EBSCO Connect is the generic platform, connect.ebsco.com, and that will give you access to the tutorials there for EBSCO's interface, as well as Cinel, etc. as well. So EBSCO Academy is our learning management system that provides additional webinar recordings. These are English speaking, e-learning paths, which features Cinel, Medline, EBSCOhost as well, and additional training courses there as well. So you would have come across that in the previous sessions. But as it is 11, I'm happy to pause for any questions if there are. Otherwise, feel free to leave the session. So are there any questions, comments, feedback at this time? I can unmute if you need to. A link there to connect.ebsco.com, which is again the main support portal, but there are others out. So I think that's it for now, and I appreciate your attendance today. And I hope that's been informative, helpful for you to understand a bit more about PBSC and searching using the PO framework. Thank you very much.